Uh, Good morning, everybody. This is the Board of Health meeting. It's Monday, August the 30th, 2021. And I'll call the meeting to order. And let's just, somehow I just got my agenda thrown in front of me here. Okay, all right, yeah. Is that you, Jim, doing that?
It is me.
Okay, good, because I had my own agenda up there. I was looking at.
Oh,
Okay.
geez.
All right.
Sorry.
So first of all, Hank, thank you for sending out the minutes. Ray, have you had a chance to look at the meeting minutes from the last meeting?
Yes, I have.
Okay, good. I thought they looked pretty good. Does anybody make a motion about approving them?
I'll make a motion to approve.
I'll second.
Okay, good. All in favor?
Aye.
Okay, so they're unanimously approved. Thank you, Jim. Thank you, Hank. So I need a little bit more volume here. Has everybody got their speakers up?
Yep.
Are you hearing me okay?
Good. That's good. That's good. All right. So now, Jim, do you want? All right. So the next issue on the meeting is the hearing, resumption of the hearing that we started last time, and I'd like to, Jim, can you just give us a little bit of bring us up to speed on that and just make your typical advisement about the hearing and that this being recorded and all that other stuff.
Yeah, absolutely. While I'm admitting people at the same time. So yes, this is the Stockbridge Board of Health meeting for, was today's date, 31st, 30th? And so this is a continuation of the 20 Mackinac Shores public hearing in which Adam from Foresight's on the call. The people getting in at the same time while I'm talking. And so it was, if the board recalls, there were some lingering questions and clarifications we needed to address with the engineer. One was notifying the Mackinac Water Association for the variance requests for their public way, identifying the abutters underground storage tank, and some additional information on a plan for the slurry pit to make sure that there's no runoff to the abutters. And so Adam from Foresight is here. He did update the well plan. I'll pull it up in a second. He did identify the neighbor's underground tank. He did put some additional information in about the slurry, and they did issue the notification to the Mackinac water supply early last week. And I don't know if there's anyone from that organization on the call, but if Dr. Kenny, if you want to make a motion to open up the hearing, I can then do a screen share and show you the updated plan.
So have all of the relevant people been admitted?
It looks like it.
Okay,
Yep.
good. All right. So I'd like to open the hearing then, and let's move along with that. Jim, let's go down each one of these items then, if you can just put them out first so we can take a look at them.
Sure. Yeah. So the abutters notification is not up on the screen, but it has been uploaded to the application. So that's already been taken care of on the application side. If you look here in Adam, if you're on, you can give the board an overview of your amendments, and I'll try to do a zoom in real quick so the board can see it. Adam, can you unmute yourself, or?
Yeah, can you hear me?
Yeah, we can hear you.
That's good.
Okay. Let's see. Screen sharing disabled. I don't know if you want.
Second. Sorry, okay. That's you should be able to. I'll make you a co-host. Try that. Try that, Adam.
There we go.
Do a screen share.
Can you see? Can you see my screen now?
We can now.
All right. So I guess first of all, the slurry pit design. I spoke with the well driller, and they're proposing a 6 by 12 by 4 foot pit with staked straw bales around that pit to collect the slurry. And typically they would do a backup pit by 6x6x4 in case that there was any additional slurry that wouldn't fit into that pit. And then we spoke just in case there was any unforeseen like ledge or additional slurry that they could have a vacuum truck on call to vacuum that slurry up so there wouldn't be any runoff. And then we added a couple boulders in front of the well to protect the wellhead from traffic. And we also identified the neighbor's well in the northern corner of their property and the propane tank in front of their house. The other comments were to notify the abutters. And I think that pretty much sums up the additional info that we were looking for.
Jim, what do you think about those items? Do you have any questions still about that, or is that satisfactory to you?
It's satisfactory to me, you know, knowing the location of the other neighbors well. It seems like a good suffice distance. Seems to be some local control on the slurry, you know, and we've notified everybody. And I mean, I don't know if the Mackinac water supply is on this call. If they are, they can identify themselves. But, you know, we do see a lot of wells drilled up in this neighborhood, trying to get off the seasonal water supply. So it's not a surprise, but, you know, just going through the motions of the variance request, I'm good to go with this application unless the board thinks otherwise.
Mr. Luttrell, do you have anything to add about this? You're the abutter on the side of where the well is going to be drilled. Is that correct?
That is correct.
Yeah. Do you have anything else to add about it?
You know, I guess, and I mentioned this before, I mean, my only concern is if they're putting in a new well, you know, under 50 feet away from our well, do we have any recourse if it affects our water supply?
Jim, what do you think about the likelihood of that happening, and what's your answer to Mr. Luttrell's question?
Well, I'm no attorney, and I would refer people to any type of legal counsel for recourse. But in my experience, I've never seen wells that far apart have issues unless you currently go through challenges with current yield. You know, if you have a water supply that's never run dry or had sufficient yield, I don't think another well 47 feet away would cause an issue like that. I've never experienced anything like that. We actually have some wells that are 20 feet apart, and I've never seen yield issues. And could it happen? Sure, but I can't speak about legalities of that. That'd be something that we would have to refer to the appropriate people. But I've never seen that, especially up in that area of town.
That's reassuring to hear, and I thank you. I mean, and we've got plenty of water. I mean, we've never had issues with production from the well.
Okay, any of the board, any other questions from the public, or anybody else want to weigh in about this? Okay, so I'd like to close the public hearing portion of this, and now I'd like the board members to discuss this as they see fit. Henry, do you want to add anything about this at this point?
No, I really don't have anything to add.
Ray?
No, nothing to add.
Okay, so under the circumstances, then I think, Jim, do you want to add something else at this point? Do you want to make a recommendation for what the next step is?
Yeah, the recommendation would be to close the public hearing and take a formal vote on the plan. But Adam, before you do that, can you stop the screen share? Because I did make you a co-host to get us back to the regular screen.
Sorry
There
about
you
that.
go. Thank you.
All right, well, I already closed the public hearing portion, so I'm just asking you what your recommendations are now for the board. Do you have anything specific? Would you recommend that we approve this?
That's my recommendation.
Okay, all right, so I'd like a motion from the board to recommend it, to approve this.
make a motion to recommend to approve.
Second,
Second,
all right, all in favor?
Aye.
Okay.
aye.
Okay, so this request has been approved by the board. The next subject is the Lake Drive septic that recently has come before the Stockbridge Bowl Stewardship Commission. Just for a little bit of background for the rest of the board members, there are quite a number of homes on the western side of the lake where Lake Drive is. Henry, are you familiar where Lake Drive is?
I live on Lake Drive.
Okay, good. So you know where it is. Okay,
Yeah.
so the bottom line is that this area has a number of homes that are on septic rather than on public sewer. And of course, the Stockbridge Bowl Stewardship Commission is interested in protecting the quality of the water on the Stockbridge Bowl, in the Stockbridge Bowl. And this subject has come up for discussion with respect to the fact that according to my understanding, and Jim is going to be the one who's going to follow through on this idea right now, there may be a number of septic systems on Lake Drive that have had some problems in the past and might need some revision or renovation in the future. And a question of whether or not this might be something that would be eligible for extension of the sewer has come up, and recently actually came before the Sewer and Water Committee in town. And so, Jim, do you want to bring us up to speed with what you consider to be the vulnerabilities of this area with respect to septic?
Yeah, and Beth's on the call too, and she did a fantastic presentation to the Sewer and Water Commission, and I was pretty excited of her information, her knowledge on septic issues. So if we ever have any openings, I'll let you know. But no, this came up years ago under Dr. Kenny's leadership when we created the cyanobacteria committee, if those remember. And it's one of those things that's come up multiple times with Conservation Commission, with the boards of health. We have a lot of challenges over in the Lake Drive area, not only being waterfronts, but there's ledge issues, there's accessibility issues, small lots. And it seems as more people put their homes up for sale, which we have to do a Title V inspection, those systems fail. Plus, we have a lot of older systems that just aren't, they're not meeting code for whatever reason. There is a time shelf on conventional septic systems. They don't last forever, regardless if they're seasonal homes. And in many cases, when we actually do an upgrade to the septic, homeowners are dropping $40,000, $50,000, $60,000 for an on-site septic system, which most are pre-treatment now, and there's well setback issues. And so as the cyanobacteria kind of evolved into this new commission, the topic of conversation constantly comes up when we're talking about water quality, environmental improvements around the bowl. Are there opportunities at some point to assess and look at possible sewer expansion to these homes in an effort to get these folks off these old substandard septic systems into maybe tie into municipal sewer? And Beth presented, and I was at the last Sewer and Water Commission, and I won't speak for you, Beth, but a survey was done. And although it's like a basic survey and there's no dollars and cents involved on engineering costs, hookup options, it was really to get a sense on X number of people that are on septic, how many would be willing to connect. And there was a pretty good results that I saw. And obviously that could change people's minds when it comes to engineering costs, et cetera. So we had that conversation, and if municipal sewer is not a priority or an option right now, is the association could always look at, is there a piece of land where you can do a shared septic and each person can put a tank in and pump up the shared septic. So there are options there, and it's just, I want to keep that conversation kind of at the front burner so we can just keep working towards that. I think in my heart of hearts, I do realize that there's a lot of work involved in doing engineering assessments and trying to figure out who's going to cover what costs for engineering, and actually trying to secure funding and to actually make it happen. But with all these millions of dollars coming down from the ARPA funds, the American Rescue Plan Act funds, and a lot of that money can be used for infrastructure. Those are just some of my thoughts and suggestions. And my role here is really acting as the facilitator, because the Board of Health and I don't have jurisdiction over sewer, but really trying to keep this conversation kind of active and trying to look at options, short-term and long-term. Beth?
Okay, well, thank you, Jim. Any questions from Hank or Ray about this right now? All right, well, the issues that I see, okay, pardon me, who's asking the question? Is that Beth?
Yes, yeah.
Okay, you want to ask your question?
It's not a question. It's just basically a statement that when I did present in front of the Water Sewer Commission back on, I think it was August 10th, they basically said that we're not in that Lake Drive Association potential sewer project is not in their 5-year plan. And therefore they kind of said, well, I think that you should look ahead, and I appreciate, Jim, that you put it on the agenda, that we should look to the health department to see maybe that would be a way of getting this project going. So that's one of the reasons I think that Jim put it on the agenda for today. I don't know I don't know who creates the agenda. I did not ask to be on the agenda, but I'm glad to see that it's on there, and that's why I'm attending the meeting. But they did kind of throw it in your commission and your commissioner department's ball court, so to speak, or your court. So.
All right, well, thank you. I actually put it on the agenda. And
thank you.
the reason the reason I put it on the agenda is I understand that the sewer and water has a 5-year plan, and I'm, what I would say about this issue is, it seems to me to be more complex than should be handled by a single committee. I don't know if you've ever heard the story of the blind man and the elephant. The blind man and the elephant, one blind man was holding onto the tail of the elephant, another was holding onto the ear, another was holding onto the leg, and they're trying to describe the elephant based on their limited approach to it. This seems to me the Board of Health obviously steps in if we have septic systems that fail overtly so that they spill E. coli and germs into the lake, and that's a traditional issue that the Board of Health steps up with immediately. We've always been obviously the first responders in that regard. Now, the cyanobacterial bloom that we had to deal with a couple of years ago is a more has a much more layered kind of a presence to it, so that, for example, what I think one of the things that is important to understand really clearly, Jim, you brought up this idea of revising the septic systems around Lake Drive, and maybe even having a shared septic system. And I'm just wondering, for example, with all of the heavy rain that we've had, and with the idea that the rock infrastructure around the bowl is a calciferous. It's a dolomitic calcitic limestone that has the possibility to have channels bored through it that allow for a fairly fast traverse of water. And since we know the lake is a hard water lake and has a lot of calcium in it, that calcium is coming from somewhere, which I would imagine be some of these underwater channels that are potentially there. I'm wondering if a community shared system, a large system like that, even though it would be protected from having E. coli get into the water by the traditional methods, could still leach nutrients into the water like nitrogen and phosphate through some, let's say, undescribed subterranean channels, or even just by surface runoff, and present an eventual problem with respect to cyanobacteria, or even just simply eutrophication and weed growth in the lake. And so I'm inclined to think that it would be important to have obviously what I'm saying is hypothetical, but when you're dealing with health issues like this, I think that what's important to do is to not discount a hypothetical idea because it is hypothetical. I think the step that needs to be taken is to prove that such a system would not be a jeopardy for the lake, and then go along with it. In other words, I don't think that we've had any systematic study of the method by which the water gets into the bowl. You know, we assume that the water comes in through the watershed, but these underwater channels that are very common in the kind of rock infrastructure that we have around the bowl have never been investigated thoroughly. Although there have been some studies like this, there was the book, The Lime Belt in Massachusetts, and there have been more recent studies that show the vulnerabilities of this kind of stuff. We haven't really had any systematic approach to it. And I think before we would embark on a huge community shared septic system, we would want to be sure that such a system would not present that kind of problem for the lake. And so I'd like to see us move along with some kind of a recommendation to the select board to put together a committee that would actually, an ad hoc committee that would actually look at this and ensure us that there isn't that vulnerability before the Board of Health would make a recommendation to the local Lake Drive people that we should have this kind of thing in place. That's the reason that I think we ought to think about this a little bit more. And I do think it's a multi-committee kind of an idea rather than just simply, sewer and water obviously has a lot of infrastructure work to do now, so their budgeting is constrained. They have their 5-year plan, obviously, but there are other issues that go beyond their jurisdiction, I think, that need to be studied more. And as Jim, as you brought out, there may be funding for this that we should investigate. So I'd like to see us consider this a little bit more. That's my opinion.
I have a question, maybe a question for Jim. Talking about shared septic systems, it would seem to me that the septic system that Krupalo has would be somewhat equivalent to a shared septic system. Is that correct, Jim?
Yeah, so Krupalo is a large septic system that's actually licensed by DEP because they're over 10,000 gallons per day. So, but yes, it would be similar to that. In getting to Dr. Kenny's point, they do have septic systems out there that do pre-treatment that can reduce some of the nitrates and phosphorus down. That is a higher level of a septic system. But even with that, the association would have to hire an engineer. You would have to go out and do perk tests. And so there's a lot of, money and time spent with that too. And I would prefer a sewer system over a shared septic system, but a shared septic system is definitely, it can definitely happen from a regulatory perspective, but there's a lot of navigating that as well. You got to get an engineer out there. You got to find a common piece of land that's got a perk. You got to have good soils. And that's like, to me, it's a better equivalent than having individual huge mounted systems that are costing 50, 60 grand, where you can have one area outside that you can just pump to and just maintain over a long period of time. But yeah, Krupalo is just a very large system, but it's not really a shared system. It's over 10,000 gallons per day, which requires a groundwater discharge permit, in which DEP oversees.
Any issues with that system?
Not that I'm aware of. But that, they've been closed for a year and a half. They're just reopened, but technically speaking, DEP oversees that system. And if they were to have problems, and they have to have an operator, by the way, it's just not a septic system that you put in the ground and people kind of ignore. There's actually like a grade 4 wastewater operator that actually maintains that system. So with all the checks and balances, there shouldn't be a problem.
I'd like to ask you a question about that. Now, the DEP oversees it. Is the DEP concerned at all with nitrates and phosphates getting into the Stockbridge Bowl? Is that something that they study and look at and ensure is not happening?
I don't know the answer to that. I'm not really sure what DEP does these days. I mean, I know they're permitted and they have an operator and they do random inspections, but that's something I could follow up with DEP to have a conversation with Dan Karpaska. If I can get a hold of him, I'll ask him those questions regarding Krupalo.
Yeah.
Any other questions about this, Beth?
It's not a question, it's just the board of the Lake Drive Association has discussed the suggestion that Jim made about having a shared septic system. And our feeling is that it's just pushing the problem down the road. That eventually, I mean, we're going to spend a lot of money to put in a shared septic system if we can, when maybe we should just be focusing on solving the problem of potential failed systems, which there will be. I mean, every system pretty much along the bowl has, along the waterfront has failed and has been replaced because of turnover of homes and failed Title V's. And so we have discussed it. We really would like to pursue more the sewer option. And I went before the select board, let's see, it must have been back in March, and discussed with them the possibility of getting some kind of allocation of funds for an engineering study. And I was told by the select board, actually, you know, by Roxanne, that there was money in the engineering in the water sewer budget for an engineering study and actually there wasn't. Because when I went to the water sewer meeting, I was told, no, there is no money for that. And that's when one of the board members, Jill Hay, who is a select person in the town of Lexington, Massachusetts, presented to the water sewer because she's aware of all the funding that's coming through with from Massachusetts and through eventually the federal government, you know, to possibly have an engineering study done with some of the monies for the infrastructure money. So as much as, and I'm not even sure if there's land, we've been racking our brains to try and figure out where is enough land. I mean, Kripalu is pretty big. I watched them putting in that sewer system along 183 because it's right across from Berkshire Country Day and that big field there. And that's a huge amount of land, I think, that would be needed to do that. And I'm not sure if we have that common land. And we also have the issues of the Tennessee gas line coming right through Lake Drive. Our whole association just sweeps right through. So anyway, I'd love to continue. Obviously, we want to continue the conversation and move forward, but hopefully the focus will be on a sewer study, not on a shared septic study. At this point, I think it would be wasted dollars personally.
Okay, thank you, Beth. I just like to remind everybody, you know, the select board works very hard, and they get, you know, and sometimes they give, they're asked questions on the fly. They have all this information floating around, and it's quite possible that somebody will say something. One of the selectmen will say something thinking that this is the case, and then because things have changed, it no longer is the case. So I just want everybody to realize that our select board is a really hardworking group of people. And if they happen to make a mistake about something, it's really, I wouldn't call anybody.
Don't take it the wrong way, please.
Oh, no, I'm just saying.
Don't take it the wrong way.
In general,
I appreciate it.
It's a very, very demanding job. You know, it's a very demanding.
Oh, I know.
I just want to bring that up now. All right, so I just want to make everybody understand that that's the general flavor that I'd like to have for our Board of Health meetings. Is that yes, sometimes people. I mean, if we're going to start to actually label the people who make mistakes, I'm going to be out there all the time. I mean, people are going to be saying, I made this mistake, I made that mistake. So I'm just trying to protect myself mostly because I make so many mistakes, but I'll do the best I can. Okay, so the second
can I just say one thing though, so it's on the record? I didn't mean to target anybody at all. I just kind of wanted to give the sequence of facts. That's all.
Yeah, no, I understand.
No worries.
I'm just saying what I said. That's all. Okay. Now, the other part of this is I think that before, you know, I think one of the things that I would like to have our board be able to do, and I'm not speaking against what Beth is saying at all, but if we can to the point where there was a consideration for one of these shared systems, I'd like our board to be able to approve it. And in order to approve it, from my point of view, one of the things that we need to know is that this is not going to provide vulnerability for eutrophication and cyanobacteria in the bowl. That's the first thing. Now, the second thing, Jim, if you, with the kind of system that you're imagining right now, just as a technical point, no, it's sort of a specific point, would you be imagining it differently? Let's say if all of the homes on Lake Drive had been converted to full-time residences versus part-time, would you think that the scale of this would be different if we just used and sized up the numbers of part-time homes there are right now? For example, we just approved a variance request on a home that had been converted from being part-time to being full-time. Would that kind of conversion affect the eventual sizing of such a
No.
shared thing? No, it
No.
wouldn't. Okay.
Based
Why
on
not?
it's based on bedroom count, whether you're part-time or full-time.
So basically you're already scheduling it for full-time.
Yes.
Yeah, okay, that's what I wanted to know. So it would be a full-time scheduled system. All right. All right, well, that's good. Are there anybody else on the board have any questions about this at this point?
No,
Do you, Henry and Ray, believe that we ought to inquire a little bit further about this? Should I keep this on the agenda so that we can acquire some more information about this and learn a bit more about it as we go along?
yes, I agree.
How about you, Ray?
Yes.
Okay, yeah, I'm glad about that because I do think this is something, and personally, I'd like to see as a goal for this, for our board, that we would eventually potentially consider making a recommendation to the select board that a multi-committee group, or maybe even involving some people from the community who are very interested in it, would be formed so that it could study it and look at the different vulnerabilities and different positive things about the different options, right? Okay, so unless there's any other discussion about that, I'd like to move along to the next idea, which is age-friendly updates. Ray, you want to weigh in on that at this point?
Jim, you shared an email with me. Did you in fact get any information?
So the response from Berkshire Regional Planning is that it's all on the Age-Friendly Berkshire's website. And I have not had time to research the website. I think what we would want to think about doing, Ray, is maybe navigate that site, see if there's anything relevant that will meet your needs. And if there isn't, we should probably get together and itemize. Well, what's kind of hard to ask what we're looking for when we don't know what we're looking for. We're just looking for information. They would know more about what they have on file than what we would. So I think
It
maybe.
was vague for sure. For response.
Yeah,
Can you
so-
send me the link to that website?
Yes, I'll re-forward that email back to you, Ray, and then we can navigate the site. And if there's anything relevant that helps meet our needs initially, we can utilize it. And I think if we want to then move that in a different direction, we should maybe set up a call with Laura
Yeah,
and say, what do you have other
Yeah.
than just the website? Because it
exactly.
seems like they have a lot of grants and stuff they do over the years, and it's very difficult to pin down exactly what they've done.
Yeah.
And that should all be privy to public information,
I would think so.
since they are a quasi-government agency. But I'll resend you the link to the website. Let's check that first, then we can then if it makes sense, I can connect the three of us with a Zoom call or something like that.
All right.
Ray, do you have anything specific you'd like the board to help you with about that at this point?
Well, I think that if you guys want to have the link forwarded to you too, and you guys can see if you can suss any, good data or information out of it, that would be helpful, I would think.
That sounds good, yes.
Yeah.
All right, so Jim, if you could send that out to us, that'd be good. And then Ray, you can always be thinking if there's something you think that you'd like the board to help you out with, if you're running into any snags or anything like that, or there's something you think that we can help you out with, please always be thinking that, to let us know about that. We'll put that on the agenda to do that, okay? We'll always have the age-friendly on the agenda, but specific items, if you think there's something the rest of the board can help you out with and we can do as a board to facilitate any kind of thing or work through any red tape, please, bring it to my attention. I'll put it on the agenda.
Thank you. And the other thing we talked about was the transfer station. I mean, they're doing an awful lot of work down there, cleaning it up. It seems the timing for having some sort of, handicapped assisted parking, the timing seems good to, have that happen now while they're making all these improvements.
So is that moving along the way you want it to, do you think?
Well, I don't know. Who was at the last meeting that said he was going to look into it? I wrote his name down and I can't remember where I put it. Jim, do you know? He was at the last meeting and he was going to look into that.
Mike Canales, the
Yes.
town administrator, yeah.
Yeah. Have you heard back from Mike?
I have not.
I haven't either. So he was going to look into that, and so I don't know. Does
All right,
anyone have his contact?
Okay.
I'll email him as well, Ray, and I'll include you about
Thank you.
his comments from the last meeting.
Yeah. Yeah. The timing just seems good because they are, making so many improvements down there.
Henry, do you have anything to add on that?
No, really don't, but I think we should get what we can and keep working on it.
Okay, so we'll put that, we'll make sure that we've got that in order with Mike for the next meeting, okay, Jim? All right. And okay, so now the next issue is the status of the COVID-19. If you remember, there's a disease out there. It's caused by the coronavirus. I don't know if any of you are remembering that. It's causing some more disease than we were hoping it would. And as a result of that, we're having a Tri-Town Health Department meeting this Thursday at 6 p.m. And if you recall, early on in this disease, there were quite a bit of government regulations insisting that people wear masks when they were indoors, limiting gatherings and things like that. And Jim, correct me if I'm wrong, we also had, the Tri-Town had access to funds to fund overtime work that was necessary for the workers of Tri-Town to enforce this and to follow through on various aspects of, like contact tracing and various things that we needed to be able to do to control the disease. And as I understand it, those funds are not available now. Is that correct?
That's correct.
And those mandates are not in place now from the state. Is that correct?
That's correct.
And so if we were to, for example, mandate as a board, that we would have indoor masking in town in all public areas, et cetera, it would be very difficult to enforce that, wouldn't it?
It'd be very difficult. Yes.
Would it be difficult to enforce a mandate? Let's say I wanted to bring before the board a question of whether we should stop the rain from happening. That would be difficult to enforce too, I would presume. And so
We're definitely not enforcing that.
All right, but I'm sure that we could get a unanimous vote from the board to do that, I would hope. But nevertheless, we're not going to do that because obviously we're not going to be able to enforce that. And I see from what I understand about this, we're in a similar kind of situation with respect to enforcing anything to stop this progression of this disease, even though if you look at all of the neighboring states, if you look at the country, the Delta variant has now begun to cause first of all, among the unvaccinated, and then even among the vaccinated now who have not received boosters, increased numbers of cases of this disease and increased deaths. So I'm just wondering what the board thinks we ought to be doing about this.
Well, I think, we're going to have a meeting with Tri-Town, and I think all three towns together can probably make some decisions about how to proceed in this area.
Ray, you're a nurse at the front lines there. What do you think?
I think that I agree that it would be impossible to enforce and it would overwhelm Tri-Town, Jim in particular. But certainly setting an example. I mean, I'm masking, I'm not going to gatherings, and I can't, the Delta variant is out there. I work with a nurse who traveled and came back and was sick, and in fact ended up positive. So I'm certainly not traveling, and I just think that we can, lead by example, and probably that's about it at this point in time, and educate, and then see what happens at the meeting on September 2nd.
And I noticed that in our audience, we have a Dr. Corman, Louis Corman. He's a gastroenterologist from DC. And I know that Louis had some interesting points to make about masks or questions. Louis, do you want to step up on that?
Did I just catch that? You asked, I just missed the last thing, Dr.
I'm just
Kennedy.
wondering, you had some interesting points or questions about masks, and I was
Yeah.
just wondering if you wanted to bring them up now.
I did. Thank you for giving me the opportunity to talk. I tracked this for our group since the beginning, where we instituted testing and in our endoscopy unit, the pre-procedure testing, and of course the Delta variant.
Louis, what group are you talking about?
Our metropolitan capital digestive care in the Washington metropolitan area. We have 65 gastroenterologists, our own laboratory. I'm also credentialed at the National Institutes of Health. So I've been following this pretty carefully. I agree with you. Trying to stop this is like trying to stop the rain, but there is an educational component. And I think a lot of that has to do with the hierarchy of risk reduction, of vaccination, of encouraging vaccination, particularly among young people. The second is ventilation capabilities, and the third, which pertains to schools, and the third is appropriate masking.
Okay, well, that's now as for why is somebody else speaking here?
Yeah, I'm not in my home, so it's a little bit of a problem. With the point that I'm making about masking is we really should be encouraging people to wear appropriate masks, move to N95s, KN95s. Again, it's not a solution, but it's better than what we're seeing. And this Delta variant is highly infectious. Mike Osterholm, who's the director of the Center for Infectious Diseases, has a podcast of which he's had 70 episodes. It's an excellent discussion of risk reduction and hierarchy. And I would, and what he does is he encourages the educational component, because trying to mandate becomes difficult. That's the basic message, is to improve the education and outreach to make people aware of what they need to do, because I think we've been going up and down with this, and the Delta variant is really creating havoc, because the asymptomatic vaccinated patients carry the same viral load as symptomatic patients. And this is what creates a problem, because the amount of virus that's disseminated is the same as if you were symptomatic. And you can be asymptomatic for 2 to 3 days before and carrying high viral loads before you develop any symptoms. Now, fortunately, the vaccine is fairly protective against serious illness, meaning death and hospitalization. But people are becoming symptomatic who've been vaccinated. That's the only point that I'd like to make. Thank you.
Well, thank you, Dr. Corman. Now, that's a very interesting point. I think hope everybody understood that. In other words, if you don't feel sick, it doesn't mean that you're not contagious. I mean, that's just
Exactly.
a general educational point for the public. I think one of the things that I regret about this whole thing is there seems to have been a kind of a negative educational aspect where the right, seems to be the case that a lot of people are mixing up freedom and with the idea of recommending masking or recommending vaccinations, as though the recommendations to wear masks or the recommendations to get vaccinated are somehow an attempt to encroach or curtail your freedoms. You know, this is I think a cardinal educational misunderstanding. You know, I hope that anybody who's listening to this or gets a chance to listen to this meeting who can understand that when in a free society, yes, we have freedoms. We can all do a lot of things. We can, as a freedom of speech thing, we can be in a crowded theater and we can yell fire. And this is a freedom of speech. But in a free society, we also, as part of a free society, somebody who is really educated and wants to support a free society understands that a free society, it also it's made up of people who have a sense of responsibility to the vulnerable people in society. And yes, not everybody's going to die from this disease, but a certain number of people are going to get very sick and die. And in a free society, the people who are free look out for the others in the community. And it is a responsibility in a free society for people to do that, or the society deteriorates. If everybody's just going to go out and be free and do whatever they want to, the society is not going to sustain itself, and none of us will have freedom. So for the long run, I would just ask you people who think that you're exercising your freedom by not getting vaccinated or not wearing masks to understand that kind of a sense of freedom is not going to be sustainable. That in the long run, our freedoms will all disappear if you just think you can just go out and do whatever you want to. It is important to consider that other people who are vulnerable need to be protected in our society, and people who please understand that this disease is a killer and it does overwhelm people. And not to mention the fact that if we have a large number of people getting sick all at once, the hospital systems will not have the antibody treatments, the plasma available. They won't have the healthcare workers. They won't have the respirators, and everything will go down the tubes, and people will die who don't need to. So please rethink this idea of just not wearing a mask or not getting vaccinated as a statement of freedom. It's a very selfish idea about freedom that isn't going to be sustainable. We are all free because we look out for each other. That's what we need to do. And this is a way that free people behave, okay? Yes, you're free, and if you have some other freedom that's being encroached upon, then we'll all step up to protect that, okay? But in this case, the common sense education says, wear a mask, get vaccinated. That's the way you should do it. This is the way a responsible person in a free society works. Not a reckless free society, a responsible free society. Anyway, I'd like to have the board members, I hope all of you will be present at the meeting on Thursday and weigh in on this as you see fit. Anything else to be added about this, Ray or Hank?
No, I think you just said it all.
Yeah.
And
Hold on.
by example and educate.
Yeah, I look forward to the meeting on
Sorry,
Thursday.
I don't mean to be obnoxious, but I'm actually on a Board of Health meeting for the Stockbridge.
Dr. Kane, you know, my final thoughts
Listening
are,
to when they're talking about.
hold on one second.
Louis, I think you're going to have to
I
mute
had to
yourself.
mute. Yeah, and I don't want to belabor my points, but I want the board to take this home with you as you think about the next couple of days before we meet. You know, and I talked to Dr. Kenny about this, and I've probably brought it up before. You know, last year when we had all the emergency situation, the state of emergency was in place, everything was shut down. So we had a full complementary of inspectors at the office, not doing restaurant inspections, not doing beach testing, which has been a handful this summer. So the capacity was there to deal with the enforcement, education, outreach piece. And so the bandwidth, we had some. Plus, we secured over $100,000 in emergency COVID relief funding to help pay for overtime, weekends, backfill, really putting information on the website. And plus the Department of Labor Standards, which is the state agency, they actually increased their staffing to help boards of health deal with cease and desist orders for those that weren't in compliance. But then we fast forward to now, all the businesses are open. The inspectors are super busy because they're doing restaurants, they're doing beaches, they're wrapping up camps, there's septic inspections. And so we couldn't be able to enforce both of those things. We would even have to shut down the entire services piece of the health department and then enforce the masking with all the places open, by the way. And I just feel like, I think we need, in my opinion, and I'll leave it to where it goes on Thursday, I would rather see like a strong recommendation on an indoor mask advisory, and we kind of put that in writing and we just get it out there, versus like a mandate, because it would be impossible for us to enforce. And the day after we put a mandate in, the phones are going to just be blowing up, and we won't be able to dispatch staff to every single business and restaurant for masking. And so those are my thoughts. And I'm not asking for a response back. I want, to think about that the next couple of days, where, we do have 2 full-time nurses now that are really doing an outstanding job. We're pushing a lot of information, a lot of education out to the community. But after 18 months of fighting this, if we can't convince people to be vaccinated and we can't convince people to mask, I don't know what else more we can do.
Yeah, I think that's a very good point, Jim. Does everybody understand that point, what Jim is making? And, if anybody wants, certainly you can make a motion to approve a mandate now, but I would agree with Jim. If we're going to approve a mandate for this, we might want to approve a mandate against the rain. The idea is that the Tri-Town has, or still you have responsibilities for contact tracing, for dealing with the disease now. And I think we have to be practical, in what we do. And I favor the idea of a strong recommendation to wear masks indoors that doesn't necessarily entail asking Tri-Town to enforce a mandate, at this point. Even though I would like to see a mandate, it's just not something that seems to be a practical utilization of our Tri-Town at this point, or something that's even feasible.
Exactly.
Yes, I agree.
All right, so are any new business or anything that I haven't put on the agenda that should come up at this point?
Well, I just wanted to talk about the type of meetings we've been having for the last year and a half or so because of this, because of the COVID pandemic. And I think it's really been terrific that we've been able to have remote meetings and hybrid meetings, sometime in person, sometimes remote. And it's also been wonderful for people who are part-time residents or people who travel can also get into meetings and understand what's going on. And I think it really has helped promote inclusion of citizens in what goes on in the town of Stockbridge. And so I think we on the Board of Health should make, if we can, a resolution to keep these type of meetings. It's been also wonderful in terms of getting up on CTSB, and also promote that the other boards and commissions in town also continue these types of hybrid and remote meetings.
Okay, thank you, Henry. Ray, do you have anything to say about that?
Yeah, I agree with the, it being out there in the public. I think for right now, it certainly seems the responsible thing to do to continue to have Zoom meetings. And we'll just see what happens. We just don't seem to be making much progress in COVID. And
Well, I personally think it's not just because of COVID at this point.
I understand.
It's because of
what you're saying.
inclusion of all our
Yeah,
population.
and I think that's important. Yeah, I definitely got that.
Yeah, I noticed a couple of times at some of the meetings, Ray, you were actually at work when you're participating.
Yeah,
Right.
that's great. Yeah,
That allowed you to do that, and I think it does increase the capability of people to participate in boards, who are otherwise also having to work. In particular, I think, this probably helps a lot of younger people who are working. When you get to be older, maybe you can retire and you don't have to work, but when you're younger, you're working, and this allows younger people to participate in the local.
Charlie, did you just
board.
refer to me as younger?
Yeah, I would say so.
A couple of points, and then I don't really have any updates, A and B, but getting to Hank's point, is I recall many years having our district meetings at Tri-Town, and they were never recorded. CTSB didn't have the capacity to record us. So there's that. But, if the board gets to a point of a resolution, like in writing, get that to Smitty, Adam Hines, and all the legislators, let them know that. And I've seen significant participation since I set up the Zoom account through Tri-Town, these meetings. Immediately after the meeting ends, I send CTSB the cloud recording, and then I download it and so on and so forth. So there's like this immediate participation with that that I want to see happen as things move along. And a perfect example, my schedule got messed up today. I had some water problems at the house. I had a plumber here. I can just open up the Zoom, still navigate the meeting. I would have never been able to do that if we were doing physical in-person meetings. So it makes it easier to navigate. And while I think there's an element of, there's energy in the room when you have physical meetings and people feed off each other, there's always that element that you'll never get. But I think we've really come a long way to adaptability of technology. And I just hope we can infuse that somehow, somewhere, when this extension for online meetings expires, that we don't go back to an archaic way of doing government business.
Well, there's something to be said about the transparency of it all, which is important when people see what you're actually doing. And
Well, I think that's a very good point. I think, all of these things put together, I'd like to thank Henry for his is that a motion to have a resolution about this, Henry?
I'd like to make a motion, yes.
Okay, all right. So we have it. Ray, do you want to second it? All right. So basically, Henry is making a resolution that we go forward as a board and continue to have hybrid meetings, even indefinitely in the future. Is that and sort of set the standard for other committees and boards in town to do that, because this has a multifactorial benefit. One of them, of course, is the immediate benefit of the COVID, but even more importantly, as you and Ray brought up, it contributes to the spirit of the open meeting law. It supports the idea that we have provided access to the community for whom we're working maximally to look at this even after the fact, because it's going to be recorded. And Jim brings up the very good point that the technology is now here to allow this to take place. And look at our meeting. I mean, we have not only do we have everybody able to communicate with each other, but we also have the audience, coming in for a lot of things and weighing in, and it in a way that doesn't that makes it accessible to people in the general public to do this. Some people might be working, yet they weigh in, or they weigh in from their homes, and they might not have the transportation to the meeting. This gives access to the general public. So I love this resolution. So can we have a vote on it? All in favor of Henry's resolution?
Aye.
Aye. Okay, this is unanimous. And so thank you very much for that, Henry. Okay, so I think then I'd like to call the meeting to an end at this point, and unless there's any objection, we'll adjourn the meeting. And remember, there's a meeting at 6 p.m. on Thursday, Tri-Town, right?
Yes.
Okay, Henry, Jim, you've already sent us all the Zoom connections for that, correct? And the agenda.
Yeah, I did send out the Zoom connections. First thing tomorrow, I'll send the minutes for the last meeting for Tri-Town, and I'll have a draft tobacco regulation I'll share first thing in the morning. I'm still working on some last minute fine tuning of that.
Okay, thank you. All right, have a good day, everybody.